maybe because of you speaking out, you've had a complaint against your medical license. Is that correct?
I did. At the end of June, I received a letter from the Minnesota Board of Medical Practice identifying that they were investigating me for 2 allegations that had been turned in. I was not allowed to know who my accusers were, but I was being advised by some of my public comments and my willingness to question on TV the Department of Health's recommendations regarding the use of COVID-19 as a cause of death, that I was spreading misinformation. And on another allegation, I was accused of reckless advice because I was willing to compare COVID-19 to prior influenza epidemics and pandemics.
Wow. One of the things you mentioned in that during that investigation when it first happened is you said, if this could happen to me, this could happen to you. So explain what you mean by that.
Well, thanks for that question. When I was comparing COVID-19 to influenza outbreaks, I'm not saying they're the same. I'm saying that they're both single-stranded RNA viruses that present with an incubation period and a latency period and have similar symptoms. And we see these kinds of things routinely. When I compare COVID-19 to influenza, I'm not doing anything that Dr. Fauci does. In a New England Journal of Medicine article in March, Dr. Fauci was the lead author of an editorial that basically said that the more we learn about the COVID-19 outbreak, the more it was behaving like a severe influenza outbreak. And one of the contributing authors was Dr. Robert Redfield, the head of the CDC. So I felt that was really unfair to accuse me of providing reckless advice when I was doing nothing more than what many physicians and leaders around the country are. For me to experience that kind of personal attack, and just a few years ago, I was named the Family Doctor of the Year in Minnesota. If someone can take the Minnesota Board of Medical Practice and turn it into a weapon whereby they can use it to try to muzzle me, then I think that anybody that has any kind of certificate or license, whether you're a nurse or a teacher, or if you're a hairstylist, if you have a regulating agency through which you must keep your license or certificate current, it's conceivable that someone could turn in a complaint, regardless of how bogus, and they could affect your life and conceivably cause your business to suffer. Shawn, I called a pharmacist that I've worked with for 30 years the other day on the phone. I said, if I write out a prescription for hydroxychloroquine, are you going to fill it? And she said, probably not.
Yeah.
And I said, why? You've never done that to me before. And she said, well, it would set a precedent. You could just tell by the way she was hesitating and sort of stammering that she didn't want to go down that pathway because she did not want to be on the government's radar screen.
Of course
so
not.
What's